Now, once we find out who is engaged next week, maybe family planning will be next on their agenda. There are some very interesting stats coming out about when women are having children. Take a look. According to recent findings from the CDC, the average age of U.S. women having their first child is at a record high. As more young women look to advance their education and careers, they should feel empowered to make important personal choices, including when it comes to family planning options. Understanding that every woman's journey is unique, practicing OBGYN and author Dr. Alyssa Dweck is here to discuss many important topics. But first, doctor, I am mentioning that average age is at a record high. What is that average age that we're finding, and what kind of implications come with this new information?
Well, look, you mentioned it earlier. The average age now is 26 for U.S. women to have their first child, and this has trended upwards over the years, but this is a record high. I think this really speaks to the fact that, number one, women are advancing their careers and their education, but also that there are more options available for contraception so that women can plan childbearing at their own terms.
And so in your time in being a doctor, what kind of changes have you seen when it comes to planning for the family?
Right. I think the biggest change I've seen is in the long-acting reversible contraceptives. So this includes the IUD, for example. And there is one IUD called Skyla, which is a 3-year hormone-secreting IUD that's effective, safe, and reversible that I've seen become very, very popular among young women who are delaying childbearing for their careers. So these are appropriate for women who have not had children yet.
Now, for women, is there maybe a point in our life that we should maybe reassess our birth control options and what we're using?
Right. I think women should reassess their options all the time. In fact, I like to use the yearly Well Woman preventative exam as a perfect opportunity to revisit contraceptive options yearly. This way we can reassess medical issues, family medical history, partner status, and needs going forward.
And so how do we start this conversation with our OBGYN on reassessing this, or what is best for us? What are the things that we should be asking?
Well, many women bring this up now, which is a good welcome change, and most healthcare practitioners in the field of gynecology will bring this up to their patients as well. So it's a very easy dialogue, but again, we take every individual circumstance separately and make a good decision for women. So whether it's birth control pills, one of the LARCs, condom use, whatnot, there are lots of options out there.
Well, definitely, I think this is new information. I think just personally, I see that a lot more women are having that first child later and later in life, and that comes along with a lot of other things in, as far as family planning comes. So if we do want some additional information, is there a place online that we can go?
Well, sure. First and foremost, I would definitely get information from your own doctor just because it's individualized. For the Skyla IUD I mentioned, you can visit skyla-us.com. And
we will definitely, like you said, make a conversation begin, make sure that we're having this discussion with our doctor. And like you said, the questions that we should be asking and what's best for us, no matter where we're at as far as family planning. So, doctor, I want to thank you so much for having this discussion with us and letting us know where we can go to get more information.
Thank you.
Now, don't go anywhere. The Morning Blend, we'll be right back.